So one is how can I reduce the risk of getting coronavirus from infected humans? So one is hand washing. Whether it's soap and water or whether it's alcohol hand gel, does not matter that much. Use what's available. And there are two aspects of the washing hands and these others that come into play. When you look at how the virus infects people, it doesn't go directly from hand to hand and cause infection. It has to get in through the mucous membranes. So the mouth, the inside, lips, the inside of the mouth, nose, or eyes. That's how the virus actually gets in. So when the virus lands on your hand in the form of a droplet, if it's washed off, it's probably not going to cause any problem. And if it gets into your face, usually from rubbing your own face with your hands that have been soiled, that's the problem. He said, why don't masks work? And he was referring to the use of masks for the ordinary person around, and especially thinking about the N95 masks. So why do they not work? Well, once you know how the virus gets in, then how much are you going to prevent by having a mask just over your mouth? You're covering a little bit of your mucous membrane, so it might make a small difference, and it might not, but the big differences are back to the good etiquette and hand washing. And there's really no reason for people going around wearing masks, especially N95 masks, which are quite uncomfortable to wear. And even for surgical masks, it's probably going to be very minimal in terms of any benefit. So here's another one that comes up. What if I get the flu shot, the influenza shot? Will it help me? And the answer is it will not help at all for the COVID-19, but the illness is so similar that it may, if you prevent influenza, it may lessen the confusion between that and the COVID-19. Is there specific antiviral treatment? And the answer is not yet. There's one drug that is somewhat promising that's being rolled out in studies. There are many other attempts, but really no evidence that any of those make any difference. And remember, this is where the vast majority of people are recovering just fine. I have a bad cough and would normally not see a doctor for it, but with this going on, should I go? And at this time, in this scenario, the answer would be no, it's better to just stay out of contact within a medical facility. Given that the virus originated from animals, should I stay away from meat and animal products? Should I worry about the animals? The answer here is that for this virus, the introduction into humans probably happened just once. So there's no reasonable likelihood that that's going to happen again elsewhere. And vice versa, it's very unlikely that you would transmit the virus to your animal. Then the next question, which is actually kind of interesting, is since children don't get sick, are they spreading the infection? And in fact, that was one of my earlier thoughts. You know, the children must be playing a role in this. And actually, so far the evidence from China is that it is not only rare to find the infection in children, it's rare to find any examples of transmission from children to adults. So your younger school children are in great shape in terms of this. We as adults are more vulnerable to infection. And the reasons for that are not known.